client messaged me and said that she was experiencing increased tightness in her neck area, generally probably this side, with it being hard to turn the head. I do have another YouTube video with stretches on it that I'll go through some stretches, and I also have a video showing you how to do some self-traction. But what I hadn't shown with this, because in times like this, you know, when we've relied on somebody to release those muscles, to do some IMS to those muscles, and we're not allowed to do that for you, how do you release the tightness in your neck when it kinks on you and starts getting tighter and tighter? And so other than stretching and taking your neck through the range of motion, a lot of times what you can do, it's usually this trapezius muscle, this big trapezius muscle that actually goes down into your lower back, but the tightness is often up in this area here. So one of the things you can do is to take this muscle, find where it's tight, and just give it a little pinch. And rather than stretching it, which would be to tilt your head away and look down, is to turn into it a little bit. So you turn your head into the stretch while you're pinching it. Now, when I pinch this muscle, it does go up into the base of my skull area. And I just want to pinch and hold that for a couple of minutes. Bauer, the therapy dog, thinks that it's a good idea. So you just pinch and hold that and see if you can get some relief by doing that. And again, you want to hold it for 1 to 2 minutes. And the referred pain into the base of the skull should gradually subside. If it's getting worse, you actually probably want to let go, because it might initially feel bad, and then it should gradually decrease, because mine's going down now. It's not so intense in the base of my skull. So that's one technique you can do. Now, often there's a tight one right back in this muscle, right back here, about the 4th rib area. That one's a little harder. Some people have a Theracane. I know I did a Theracane one on Facebook, but it's not on the YouTube channels. It was just a Facebook post. So since I don't have a Theracane here to show you, next best thing is to have a ball. Now this is not a hard ball, but if you have a harder tennis ball or something, put it into a sock down at the bottom. What you're going to do here is you can take this with it and flip it over so it will get that area there. And now you come up to a hard surface like a wall. You can just put that ball there, and you can put some pressure and roll on that spot. That's a little harder to reach. And again, that might make it ache down the arm a little bit, but once you find the spot, you can just do a little pressure stretch, hold, lean into it. You can roll around if that feels good. It should feel good. Lighten up how much you push pressure into it. If it's too much, just lighten off. Or you can dig a little bit and roll around. So you can either hold it in one spot, and that way, again, it's 1 to 2 minutes of holding it, and it should decrease the pain the longer you hold it. So that's another technique with the sock and the ball in there. And the other bit of advice I can give you is I often will use a joint rub right at the side of my neck. Even if the muscles feel tight at the base and this muscle feels tight, I'll use the joint rub on there. And I personally like heat application. You want to make sure you're not going to burn yourself. A magic bag that gradually cools off is good. And heat that up for 15 to 20 minutes. Just again, being careful not to burn yourself. Some people, if the joints are irritated underneath, prefer ice. And again, you don't want ice directly applied to the skin. You'll want to put it either in a damp cloth or a thin dry cloth, so it's not to burn you. And again, 10-15 minutes should be enough to at least dampen down the pain for you. So it's whatever gives you the most relief. And some people go back and forth and use one and then the other, depending on what kind of relief they're getting. So those are a couple things you can do. Another one, you can just take the fingers here, and usually it's tight right here at the base of the skull. So what I will do is I will just get my fingers and dig right in at the base of the skull there. And again, it shoots up a little bit here because there's the occipital nerve there. And I'll just do a little light massage. I actually will do this lying down because it's a little bit easier for me rather than holding my arms up to do the massage in that spot. And again, it should feel like it is releasing the more you do. And there's usually a spot right here about the middle of the neck that also can get a little tight. And that one, again, you can just lightly rub on that, but it should feel better the more you do. So another one I'll do is I'll just hook my fingers into that spot as I look down towards the floor and pulling up. That's a bit of a self-traction at that level with my hands. So I'll just apply a little pressure with my finger there and pull up as I look down. And usually you can feel where it's tender and tight. So we want a traction. That's a specific traction for that area. So those are some ways that you might be able to try to release that tightness in the neck that's been building and you don't have access to your physiotherapist. So it's Wendy Bowen, physiotherapist, signing off. Thanks for watching.